Now we have liver. Liver is the major boss here. Liver senses the presence of intrahepatic stores of iron. It knows how much iron it is stored in the liver. Okay. Now, when liver finds out that there are very high levels of iron, or it may be that liver has very low levels of iron. Okay. Whenever there are high levels of iron, this will start inhibiting hepcidin synthesis. Okay, sorry, it's not inhibiting. We look at it. It secretes hepcidin. High levels of iron, it secretes hepcidin, and low levels of iron inhibits secretion of hepcidin. Okay, liver is the main organ which senses the presence of intrahepatic stores of iron. We might have high levels of iron, or we might have low levels of iron, or there might be normal levels of iron. Considering that there is very high level of iron in the body, it will start secreting hepcidin, and this hepcidin has direct inhibitory effect on ferroportin. So when it has inhibitory effect of ferroportin, there will be no absorption of iron. No absorption of iron. No absorption of iron, and finally the excess iron is shed off as mucosal epithelial cells. Whenever there are low levels of iron, it inhibits the secretion of hepcidin, so there will be increased uptake by ferroportin into the plasma. Okay, this is what we need to understand. Now, what is hepcidin actually? Let's look at it. You will tell me what is hepcidin, sir. So what is hepcidin? Hepcidin is nothing but it's a small circulating peptide synthesized and released from the liver in response to intrahepatic levels of iron. So this is the hepcidin. What is the central role of hepcidin? Hepcidin plays the central role in iron homeostasis. How? It inhibits ferroportin. This leads to mucosal trapping of Fe2 plus, and this leads to increased sloughing of cells, thus the iron is lost. Okay, then another one, what it does too, it inhibits iron release from macrophages. It inhibits iron release from the macrophages. That is the bone marrow and spleen. So if macrophages will not release the iron, suddenly, not suddenly, over course of time, when the macrophages die, the iron will be lost with them. So this is how hepcidin, how it controls the iron homeostasis, and it is secreted by the liver. This is how the entire process of absorption of iron as well as how is it regulated by the liver is known as. Moving on to, there is something called as anemia of chronic disease. You will tell me anemia of chronic disease. Whenever there is chronic disease, how does it leads to anemia? Let's look at it. What is anemia of chronic disease? We are not going into the details of it. We just discussed how a chronic disease can cause anemia. What is anemia of chronic disease? Okay, what happens whenever there is a chronic disease? This one secretes inflammatory mediators. It secretes inflammatory mediators, and these inflammatory mediators leads to increased hepatic hepcidin synthesis. Increased hepatic hepcidin synthesis leads to destruction of ferroportin 1, and when the ferroportin is lost, there will be loss of iron through mucosal shedding. So this is how a chronic disease leads to anemia. Now I just told you the liver senses the intrahepatic source of iron, and whenever there are high levels of iron, it will leads to increased levels of hepcidin, leading to inhibition of ferroportin and loss of iron from the body. Now why is it that when in the case of hemochromatosis or in case of iron overload conditions like beta thalassemia major, the liver should do the same thing, right? Excess iron should be thrown out of the body. But what does happen? What happens whenever there is iron overload? So what happens in hemochromatosis, excess iron overload. So normally iron overload should lead to increased hepcidin and iron loss through shedding. But this does not happen. Now will ask me why. Let's look at it. We look at hemochromatosis. Either it can be primary genetic cause, or it could be secondary, such as beta thalassemia major. In both of these conditions, it actually leads to expansion of erythroid progenesis. Expansion of erythroid progenitors. This leads to increased secretion of erythroferron. And this increased secretion of erythroferron has direct inhibitory effect on hepatic hepcidin synthesis. And whenever the hepatic hepcidin is low, it leads to increased absorption by the ferroportin 1. So this is how, even though there is iron overload in case of hemochromatosis, there will still be iron absorption and not iron excretion. Okay, so this is how it is regulated. Now let's look at a condition What if a patient has come to you with an iron deficiency anemia and you have prescribed him as iron tablets or IV iron, but he is having failure to respond to iron therapy. Failure to respond to iron therapy. A patient will come to you with iron deficiency anemia, and whenever you prescribe him iron tablets or you'll give him intravenous iron therapy, but the patient is failing to respond to the iron therapy. So this is a rare form in which you have to consider. It's a rare form of microcytic anemia. It's a rare form of microcytic anemia caused by mutations in the gene known as TMPRSS6. So this is a rare form of microcytic anemia caused by mutations in the TMPRSS6. This is nothing but as this TMPRSS6 is nothing but as hepatic transmembrane serine protease. And what does this do? This suppresses hepcidin production. This suppresses hepcidin production when the iron stores are low. Suppresses hepcidin production when the iron stores are low. This leads to high hepcidin levels, which directly leads to reduced iron absorption. So this is what happens whenever the patient does not respond to the iron therapy. It's in a rare case of mutation. So this is about the iron deficiency anemia. In the next, we'll look at the etiology of iron deficiency, the clinical features and the treatment part.